Data is the new gold, especially as countries tap on digital surveillance and data gathering tools to curb the spread of COVID-19. And the Institute of Policy Studies held an online forum earlier today to discuss how personal data should be used for the common good and the tensions that arise when this happens.
And for more, we're joined by Dr. Carol Sonn, Senior Research Fellow at the Institute of Policy Studies, and Dr. Sonn from University College London. Thank you very much for joining us. So, Dr. Sonn, I want to come to you first. Set the context for us. So when we're talking about the sharing of personal data for the public good, what does that involve?
So when we look at the case of COVID-19 right now, what's happening is we need people to share their personal data so that we can help with contact tracing, which is an immensely laborious and human-intensive task. So so the GovTech, the Singapore government, has rolled out Trace Together, an app that when compared to many other apps around the world, actually requires much less information from users. And think about it, if everybody contributes and downloads the app and uses it, post-circuit breaker, when we hopefully can resume some form of normalcy in our life, it will help us control the outbreak. And that actually has positive implications for everyone, and everyone actually stands to benefit. But I think this whole question about sharing of personal data for public good has broader and more long-term implications than just a pandemic, because we want to think about during a non-pandemic time, when we share personal data, whether it's in the medical domain or even in the transportation, how we are actually helping everyone, and by doing so, we're actually helping ourselves.
Well, let's look at some examples then. Dr. Sonn, tell us, how has data technology helped countries like South Korea and China manage their outbreaks?
In South Korea, the digital surveillance technology played extremely important roles. From the beginning, South Korea had a very large capacity of testing, but who is to be tested? Not all patients were clean for testing. So many patients, primarily those in their 20s and 30s, continue to live normal lives, spreading virus without realizing that they are infected because their symptoms are mild or non-existent. They have to be found and to be tested. And digital surveillance technology helps in finding them. So patient tracing in South Korea was based on combination of patient interviews by epidemiologists and surveillance technology such as mobile phone location data that Center for Disease Prevention and Control can get from mobile network providers, and cashless transaction records that are available from banks. And so these surveillance data merged with interview of a patient to fully reconstruct the past mobility of the patients. And afterwards, people who are in close contact with the patients can be identified and asked to come for test. Currently, the ratio between confirmed cases versus number of tests is 2%, which is very low. And this low ratio indicates that enough tests are being conducted. And that's partially thanks to the extensive use of surveillance data for patient tracing.
Yeah, but Dr. Sonn, help us understand as well the challenges of governing location data and other personal information, especially in a very built environment.
Right. In terms of data collection, there is almost no difficulty. Mobile network providers and the bank already have the data about the location of the phones and the location of the transactions. What is critical is to determine when the government gets access to those data. If too much discretion is allowed to the government, there is always danger of abuse. It is tempting for the government because location data can be useful for many purposes. And that is why it is important to legislate the data access with extreme specificity on when and how the government gets access. And then apparently there were some problems found in South Korean legislation, partly because this is the first time that this law was implemented for pandemic control. And so obviously technology changed very fast, so it is not easy for the law to be up to date. But I can't think of any other way. Have to be very specific, even if those specificities make it difficult to make the law to up to date. So the only solution is make it specific and then revise it again and again every time it is necessary.
And Dr. Sonn, I want to get your thoughts on the barriers to Singaporeans' willingness to contribute their personal data, even in a public health and security crisis such as the pandemic we're facing now.
Right, I understand. Look at what's happening right now during COVID-19. The adoption rate for Trace Together is actually is very low, right? We are looking at 25%, when the required adoption level for the app to work effectively is actually 75%. So if we want to talk about barriers, I think there are a few. One of which at the most rudimentary level is the technological barriers. We have heard reports from Apple iPhone users, who clearly are experiencing some compatibility issues. But GovTech has said that it is in the midst of working closely with Apple to see how to improve the interface and so that the app will work well on iPhones. So that is one barrier at the technological level. Now, at the other level would be at the cognitive level, because currently many people feel that because they are at home, they are abiding by the restrictions, there really isn't a dire need for them to download the application and start using it because they just can't imagine it being of any value to them right now. But like what some of the policymakers have mentioned last week, as June the 2nd approaches and we are slowly loosening the restrictions, we will need as many people as possible to download the app so that we can hopefully prevent, touch wood, another wave of infections, which may bring with them another wave of stay-home measures and restrictions. So that is another kind of barriers. Now, the third barriers would obviously be privacy concerns. And in the past 2 years, we have seen some data breaches. For example, the hacking of records of blood donors, as well as the Sing Health patients 2 years ago. So some of these things are obviously still very much in public consciousness, and there could be some residue, fear or anxiety with regards to whether their private or personal data will be kept and stored safely. So these are some key issues which we need to overcome so as to encourage people to share their personal data more readily.
Many thanks both of you for speaking with us this evening. Dr. Carol Sonn from the Institute of Policy Studies and Dr. Sonn Jung from the University College London.